Welcome back to the Deep Dive. Ever feel like you're just dragging, constantly exhausted, and sleep doesn't seem to help? Well, it might be something deeper. Today, we're looking at a really key test, the Ferritin blood test.
Yeah, we looked into this on Blood Test UK. It's quite interesting. So, ferritin, the simplest way to think about it, it's like your body's own little storage tank. The iron.
The storage tank for iron.
Okay. Yeah, exactly. It's a protein that just holds on to the iron. And this test basically measures how full or empty that tank is.
Got it. So our mission today is figuring out why checking that tank level is, well, such a big deal for your health. We'll look at the benefits and also some local info, particularly for the St Albans area, based on that Blood Test UK source.
Right. And the interesting thing is it's not just looking for one problem. This test has a kind of dual purpose. On one side, it spots if your tank is too empty, that's iron deficiency, maybe anemia. That's what often causes that awful tiredness.
Okay, the low iron side, that makes sense.
But, and this is really critical, it also checks if the tank is too full, too much iron. That condition is called haemochromatosis.
Too much iron. I think most people worry about not having enough. How serious is having too much?
Yeah, it's often overlooked, but it can be quite dangerous long term. If haemochromatosis isn't treated, iron builds up silently in your organs. We're talking serious risks to the liver, maybe leading to cirrhosis, even liver failure, and heart problems, diabetes too.
Wow, okay, so early detection is really key there.
Absolutely, that's the main benefit, catching it early, preventing those really severe downstream problems before they, take hold.
Okay, but back to the tiredness thing. Everyone feels tired sometimes, right? How do you know if it's serious enough for this specific test?
That's a fair point. It's usually when that fatigue comes with other things, like maybe shortness of breath, looking quite pale, or if you already have something chronic going on, like kidney disease, maybe inflammation issues. Those conditions can mess with how your body handles iron.
Ah, I see. So the test gives you actual data. It confirms if low iron is the culprit behind those symptoms or if it's something else.
Precisely. And it's not just for diagnosis. Say the test shows your levels are low and you start treatment.
Like taking iron supplements or changing your diet.
Exactly. Then testing again later helps you and your doctor see if those changes are actually working. Are you refilling the tank?
Right, monitoring progress. Okay, let's bring in the local angle. What did the Blood Test UK info say about St Albans?
Well, the guidance from sources referencing the St Albans area really hammers home the idea of balance. They stress that low levels don't just sap your energy, they can affect your thinking, your focus.
Brain fog.
Yeah. And on the flip side, high levels, they need pretty urgent medical attention because of that organ damage risk we mentioned. Things like liver disease.
Okay, practical stuff then. If you're in or near St Albans and you need this test, where do you go? What do you need to know?
The source material mentioned places like St Albans City Hospital and also Spire Harpenden Hospital as potential providers. How often you need testing really depends on your health situation. If you've got ongoing issues or if you're pregnant, you might need it more often, maybe annually or even biannually for some risk groups.
And what about preparing for the test? Do you need to fast?
Usually, no. Fasting isn't required for a ferritin test. But, and this is important, always check the specific instructions from the clinic in St Albans and definitely talk to your doctor about any medications or supplements you're taking.
Why is that?
Because some things, like iron pills obviously, but also some anti-inflammatory drugs, can actually change the result. Ferritin can temporarily spike if there's inflammation somewhere in your body because it's what's called an acute phase reactant, so it could give a misleadingly high reading. Always best to check.
That's really crucial advice. Okay, so wrapping this up for you, the listener, what's the main takeaway here? Getting your ferritin checked seems like a really smart, proactive step. Better energy, maybe better mood, definitely better long-term health insights. Simple test, big impact.
Absolutely. And one final thought, connecting back to lifestyle, something the Blood Test UK source touched upon. Your daily choices matter for that iron tank. Things like eating iron-rich foods, leafy greens, red meat are often mentioned, but also getting good sleep, managing stress, these can all positively influence your iron stores. So the question to ponder is, what small changes could you start making today, even before getting tested, to help keep that iron storage balanced?
Definitely something to think about. Use this knowledge to take charge of your health. We'll talk to you next time on The Deep Dive.